Everybody, my name is Julie DiRossi King. I am the Director of Policy and Public Affairs for the Ohio Association of Community Health Centers. We represent all of Ohio's 43 federally qualified health centers and FQHC lookalikes, more commonly referred to as community health centers, serving over 550,000 Ohioans each year among 200 healthcare delivery sites. I really want to thank you for taking the time this morning to come talk about infant mortality in Ohio. Unfortunately, our track record in Ohio isn't such a bright spot to kick off the week, especially coming off of Mother's Day weekend. Happy Mother's Day to all the moms in the room. But critically important nonetheless, so a sincere thanks for making and taking the time to be here today. Senator Jones and Senator Tavares have done an outstanding job of shining the spotlight on a problem of far too many infant deaths in Ohio, and they've put forth a legislative package to address the issue. We are here today to respectfully urge the Senate to act now on one concrete solution, in particular Senate Bill 279, jointly sponsored by Senator Jones and Tavares. Just a quick recap of why we are here and why the state of Ohio needs to act now. The United States trails almost all other developed nations in infant mortality, and Ohio ranks near the bottom of all the states. We are 48th overall in the United States, despite being responsible for the 7th largest amount of births. Specifically, we are 37th among Caucasian babies and 49th for African American babies. In 2012, in Ohio, 1,045 babies lost their lives before their first birthday. I know you will all agree with me when I say that is 1,045 too many. And frankly, that statistic stands on its own and speaks volumes. In fact, I could probably end my talking points and conclude right there. But because we are urging the Senate to act today on Senate Bill 279 and use one of the MBR bills as a vehicle to get it passed as soon as possible, I do want to say a few words from the cost perspective. Low birth weight babies born to women on Medicaid account for over 50% of all Medicaid birth expenditures, but only represent about 10% of all Medicaid births. Significant savings can accrue from enabling mothers to add just a few ounces to a baby's weight before birth, an increase of 250 grams in birth weight, which is just about a half a pound, saves on average $12,000 to $16,000 in the first year of medical expenses. Premature babies in 2007 in Ohio resulted in costs nearing $1 billion, and that does not include costs associated with maternal hospitalizations or long-term health problems and disabilities. So as you can see, Ohio's infant mortality rate is abysmal. We have reached a crisis level, and we must act now to prevent infant death. To begin to address the infant mortality disparities that exist in Ohio, establish clear and consistent goals, and provide a pathway for scalability, we strongly support Senate Bill 279 and encourage its immediate passage. As such, because the state legislature will soon be going on recess, we urge the Senate to amend Senate Bill 279 into the MBR bill so that we can get to work today and not wait for passage later this year. And just a brief couple words on Senate Bill 279, and then I'm going to bring up one of our panelists to get us started. Senate Bill 279 seeks to develop a targeted demonstration program using the model of centering pregnancy to improve birth outcomes in 4 community health centers across the state, 2 in an urban setting and 2 in a rural setting. So with that, I'm going to bring up Nancy Barron, ask her to join me at the podium to speak to the centering pregnancy model of care, what it is and why Ohio should invest in a bill that would promote this program in some of our highest need communities. Nancy is a certified nurse midwife, also oversees a centering pregnancy program at Tri-Health Nurse Midwives in Cincinnati, but she joins us here today to speak on behalf of the Centering Healthcare Institute based in the state of Maryland. Nancy?
Thank you very much. Thank all of you for coming and listening to such an important effort that our State House is taking up. I'm sure you're all aware of all the infant mortality rate that needs to be improved in the state of Ohio. I think centering pregnancy should be a big part of the solution that we have. So what is centering pregnancy? Centering pregnancy is healthcare that is proven to be outcome-driven, it is cost-effective, It is evidence-based, and it's a patient-centered model of care. You're getting the patients out of the exam rooms and into groups, working with each other and building communities. What we do is we take women with about the same gestational due date, we put them in groups, and we have them travel that journey of pregnancy together. During that time, they get care, they get education, and even more than that, they get community building that takes it beyond the walls of our office. Okay? It gives their prenatal care in the group, so it's a combined education, community, and prenatal care. These groups are led, they're scheduled 2-hour sessions. They're facilitated by a credentialed healthcare provider that has been trained in facilitated discussion. The group sessions allow time for sharing and support. They enable patients to establish trust and discuss issues and complex health issues amongst themselves. So what does centering deliver? It delivers improved outcomes, reduce the odds of preterm birth weight between 33 and 47% across the studies, centering pregnancy. It's patient-centered. Patient satisfaction rates for providers as well as for patients are very high, 95% for patients. This lowers the healthcare costs based on decreasing the preterm delivery rates and the benefits of increased breastfeeding rates that we see amongst clients that are involved in centering pregnancy. This is not just a new way to do prenatal care. This is an innovative system redesign. We're designing the way that we are doing healthcare for pregnant women. The Centering Healthcare Institute has had 2 decades of experience in working with this design and showing statistically how it does improve these outcomes. Centering Healthcare Institute is a nonprofit. It is a 501c3. The purpose of the Centering Healthcare Institute is to use as a consultation and support to help systems set up these redesigns for a long-term commitment and long-term success with their programs. They train the groups, they train the facilities, they train everybody from the CEO of the program all the way down to the person that answers the phone at the front desk. You need everyone in the practice involved. Once you're trained, they have site approval that comes back and helps you maintain a successful practice, and they collect the data to use for the research study. So let's take a look at the number. One preterm baby, according to the Institute of Medicine in 2006, cost $51,600. One preterm baby. So think if we decrease the preterm delivery rate 33%. In 2011, the 100 programs from Centering Pregnancy saved the healthcare system $44 million. If you adopt this system per mother, the savings is $2,094. If you have 360 moms that deliver, that saves your healthcare system in 1 year $754,000. We're talking about a lot of money, besides the fact it develops communities, relationships, and goes way beyond their initial delivery. The centering difference is a results-driven model that repeatedly demonstrates better outcomes in clinical studies. In Ohio, specifically, the one research program they had, the centering odds reduced the odds of preterm birth by 41% in African American women. That is a lot, 41%. It also increases your breastfeeding rate. So we put these women in their patient-centered groups, the patients take ownership, their needs are anticipated, we build strong relationships, not with the mothers, but with whoever their support person is, with the fathers, with the grandmothers. Who they identified as their support person is also involved and builds those relationships and builds those communities. They share this knowledge, and it also is care that is culturally appropriate, and they're customized for the areas that you give care in. So I think about centering counts as like a triple aim here. Centering pregnancy is one of the tools to help reduce your infant mortality rate. It is a better way to give care. 90% satisfaction. If you build it, they will come. They will not only come, they will stay, and they will come back. And that's what we need. It's better health care, 30% lower preterm birth rates, 20% increased breastfeeding rates, and that lowers your costs. Up to, depending how many you have, thousands of dollars, billions of dollars if we apply this across the United States. Please support Senate Bill 279. It's for our mothers, for our babies, for the fathers, our families, and for healthy communities.